Hello, everyone, and welcome to our webinar presentation called Understanding Concussions and What to Do if One Happens. I'm going to be your host for this video. My name is Carissa Smith, and I'm a physiotherapist at Peach Physiotherapy, and I have a special interest in concussions. I love treating them, I love talking about them, and I love helping people who've experienced one. So this is right up my alley, and I'm very honored to be taking you through this presentation today. First things first, before we get started into the nitty-gritty about concussions, why don't I introduce myself? So I'm a recent graduate of Western University, go Mustangs. I did both my undergraduate and master's degrees there. My undergraduate degree I did in health sciences. I absolutely love Western, and lots of what I know about concussions, I learned during my time volunteering and also as a physio student at Parkwood Hospital, which is where I gained an interest in neurological conditions and how the brain works. I am not a Chatham native. I hail from the Almonson and Petrolia area. That's where I went to high school. And my journey into physiotherapy has been a pretty typical one. I loved my degree in health sciences. I loved working in the healthcare field. And I also love being active. I love running, lifting weights, hiking, traveling, anything moving and grooving. So combine my love of the human body with that love of being active. And physio was a no-brainer for me. So that's kind of how I got started in doing the stuff that I do today. Very happy to be part of the Peach team and helping people in the Chatham area get back to doing all of the stuff that they love. This is a quick schedule for today's discussion. We're going to do a quick intro and rundown about what concussions are, what things that you can be doing in the first couple of days if you think you might have had a concussion, how much is too much and what's not enough, some tips and tricks, and how physio can help. So really, I want this video to be an education piece for people who might have experienced a concussion, might think, I'm not sure if I have one or not. I don't really know what concussions are. So they're trying to get a better understanding of what they can do for themselves and also help loved ones. So if you have someone in your life who has sustained a concussion, helping to understand what they might be going through a bit better and how you can help. So let's start getting into some of the nitty-gritty stuff. What is a concussion? So a concussion is a form of mild traumatic brain injury. So if we think of brain injuries as a spectrum, a severe brain injury would be something that leaves you maybe unable to walk, unable to take care of yourself properly. That would be something that's really, really severe. The other end of the spectrum is you've still had a brain injury, and maybe those walking and taking care of yourself things are fine, but there's a lot of other pieces that are still impacted. To have a concussion is usually you've had a blow to the head, which results in a sudden bouncing or twisting of the brain, which can cause stretching and or damage of all of the really sensitive cells that make up your brain. So think of your brain like a muscle that's been injured. It's now been depleted of its energy resources, and right now it needs all of the resources it can to heal. It's also going to be very vulnerable to new injuries, which is why when you have a concussion, it's important to avoid continuing sports or other things where you might hit your head again. Bit of a quiz, pop quiz time, true or false? Do you think that concussions will show up on x-rays? So the answer to this is false. Concussions will not show up on most traditional imaging. So if you think of x-rays, CT scans, MRIs, those sorts of things, concussions aren't going to show up on these sorts of imaging. Anything that you might typically find in a hospital, it's not going to show up, which is why chatting with your healthcare professionals and your team is going to be really important in diagnosing a concussion. All right, so something has happened. You're not sure if you've had a concussion. How do you know if you've had one? Many people don't know how to recognize the signs and symptoms of a concussion until a couple days have passed or you're well into like concussion healing territory. First and foremost, the best way to tell if you think you might have had a concussion is to have an evaluation with a qualified healthcare professional. So, whether that's going to primary care, so your doctor, emerge, or going and seeking help from an allied healthcare professional, such as a physiotherapist, or some chiropractors are also trained in concussion diagnosis. First and foremost, though, the first thing that needs to have happened is that you sustained a head injury. Okay. So you have to have had a blow to the head, either some sort of like whiplash injury, like in a car accident, you've had a fall where you've hit your head on the ground, or another object, such as a ball, another person has come into contact with your head. Some other signs and symptoms of a concussion include the 4 H's. The first H is headache. So pain in your head that comes and goes, or it can be constant in nature. Hurling. So this is my way of making an H word out of the symptoms of nausea and vomiting. You hate light or noise. So sensitivity to these things, including the light from screens. And then haziness or brain fog. This is a feeling of just being in a mental fog. Like your thought processes aren't quite clear. It takes a lot more effort to kind of have a normal succession of thoughts, those sorts of things. You just feel a little bit sluggish. There may be other symptoms such as dizziness, memory problems, emotional disturbances, balance problems, lethargy, concentration difficulties, or reading difficulties. And then another common symptom you might start to notice is behavioral changes, such as irritability, anger, frustration, especially in young children, because they're not as easily able to vocalize some of those other things that we've talked about, such as a headache or nausea. So then they start to act out, and you notice some of those behavioral changes instead. So we are going to do a quick test. This test is in no way diagnostic of a concussion, but it's a fun exercise to see how your coordination is doing. So I'm going to have you sit upright in a chair with your back supported and neutral. Take your index finger and extend your arm like you're pointing at someone in the distance. Then bring your finger back to touch your nose. Repeat the exercise, but a little bit quicker this time. And now keep going, but close your eyes. How'd you do? Normally, you should be able to do this exercise and not miss your nose as the target. So if you can't do this, it doesn't mean that you've had a concussion. But if this is something that's really hard for you and you've had a blow to the head, maybe it's time to go talk with a healthcare professional. Throughout the presentation, we're going to hear from concussion patient Claudia, who went from having a severe concussion to being completely symptom-free today. This is the beginning of her story. A couple of years ago, I was diagnosed with a severe concussion after I slammed into the boards during a hockey game. It altered my life quite drastically. I had trouble focusing, remembering, and making sense of simple everyday things. I also experienced depression, anxiety, pain, headaches, trouble balancing, and was extremely lethargic. This kind of story might sound familiar, and like many people, at the beginning of her concussion, Claudia was instructed to rest alone in a dark room for 2 weeks with no reading or screens. We're going to chat about how that's actually not the best strategy for healing concussions and what you should do instead. You may have heard that it's important to rest for up to 2 weeks following a concussion. This used to be the recommendations. However, the research and the consensus has evolved to reflect recent studies that show it's important to start reintroducing your normal activities after a maximum rest period of 24 to 48 hours. This is because after a concussion, your brain is depleted of all its energy resources trying to heal from the impact. And you should rest for 24 to 48 hours if you're feeling those symptoms of a concussion that we discussed on a previous slide, such as a headache, nausea, or dizziness. But the most important things in the first 24 to 48 hours are lots of sleep, proper nutrition, so making sure you have all of the vitamins, minerals, and nutrients that you need for your brain to heal, lots of complex carbohydrates, because those are really important for brain metabolic health. And then, of course, proper hydration. So drinking lots of water. Then the things to avoid within that first 24 to 48 hours are screens, really intense physical activity, difficult cognitive tasks such as socializing, reading, and then school or work. If you take nothing else from today's presentation, this slide encompasses almost everything that we're trying to do with concussion rehab. So if you're feeling symptoms, you can rest for the first couple days, but then we need to start reintroducing activities with what we call a graded approach. The key here is graded, meaning you start adding in regular activities normally without exacerbating your symptoms. So this model is a great way to visualize how to approach activity after a concussion. This was developed by the outpatient brain injury team at Parkwood Hospital. And what it's trying to show is integrating activities that might make your symptoms worse. So that left axis up and down is your symptoms, and then the bottom one is time. So you might do something like a walk that makes your symptoms go up a little bit, and then you're going to alternate it with something that does not provoke your symptoms at all. For example, for a lot of people, these are listening tasks, so like a podcast. Then if you want to do something else that you normally do, say watch an episode of TV, and that makes your symptoms a little bit worse, you're going to alternate it with another activity that is non-provocative, such as making an easy dinner. The goal here is that you're working in your normal activities without going above that symptom threshold where things get a lot worse. It's important to participate in all of your regular activities, but stop before symptoms come on. So once you start to feel some of those symptoms increase, it's important to take time to rest. So what are some things that you can incorporate when your symptoms are on that upswing? All of the things on this slide are really beneficial in the early stages of concussion management, and later on, even into post-concussion symptom territory, for helping to reduce flare-ups. So mindfulness and meditation apps like Calm or Headspace are game changers for helping to quiet your mind. Doing things like pet therapy is really useful because it just helps with those feelings of comfort, and it's a really easy, light task. So just hanging out with your pets if you have them. Calming is a technique where you take your hands. So this is actually a counseling technique. You take your hands and you place them over your eyes like this when you're starting to feel some of those symptoms come on. And I find this especially helpful for my patients who are sensitive to light and it brings on their headaches. If you do some of this palming, you're kind of blocking out the light and adding some nice pressure in and around that ocular area, which helps a lot with symptoms. If you find yourself, in a public space, you need something quick that's going to reduce your symptoms, you pop into the washroom and do some of this. And then grounding, that's another counseling technique that can be really helpful. Other things like weighted blankets can also be helpful for people. So I know what you're thinking. If walking and watching TV are things that are going to make your symptoms worse, what are activities that are concussion friendly? So here are some activities that are concussion therapist approved. Number one is listening tasks. So whether that's an audiobook version of your favorite book or podcast. A lot of my patients really like listening to concussion education podcasts as part of their treatment because it helps them learn and understand what's going on, but then it's also a nice, easy task to incorporate into their day-to-day. If you have an easy craft or hobby that you like to do, that can be a good one. So easy, like thick knitting, easy painting, not really fine, but things that are a little bit abstract or don't take a lot of concentration or detail can be really good. And then adult coloring is another great one. Easy card or board games and puzzles. These are especially great when you have family members that you want to hang out with, and watching a long action movie like Lord of the Rings is not going to be a good idea. Doing easy card or board games can be a great fun activity to swap out instead. And then light household tasks, because you still need to do these things. So laundry, meal prep, light sweeping or vacuuming. So let's do a little bit of an evaluation. Is your favorite activities or some of your favorite hobbies, are they concussion friendly? So for example, I love all things hobby related. I love sewing, I love painting and baking. And then you can also find me frequenting the country roads near Rodney as I run and train for various races. So looking at some of my activities, I know that after a concussion, I would have to reduce my exercise intensity and maybe swap out the running for something a little bit lower impact, like a yoga or Pilates class, if those are better tolerated. And then in terms of the sewing, it's really, really small stitches and stuff. So I might have to switch and do some of my easy abstract or landscape watercolor painting instead. So think of some of your favorite hobbies and what you would be able to do if you had a concussion, and what are some things that you might have to do a little differently. Okay, time for another pop quiz. True or false? Number one, concussion symptoms take years to go away once you've sustained one. So, what do you think? The great news is that most concussion symptoms should resolve over approximately 2 weeks in 90% of people. So I would say that this one is false. By following the guidelines proposed by some of the sports researchers and on the slides before, and reintegrating some of your regular activities as tolerated over that period of 2 weeks, most adults will find that their symptoms resolve and they can continue with their regular activities. But what about that other 10%? There are many factors that play into why someone's concussion symptoms may not resolve, and it doesn't necessarily mean that it was a worse injury, but everyone is different and may need professional support as they recover from their concussion. These people whose symptoms linger, we classify as post-concussive symptoms, or what you might have heard is called post-concussion syndrome in the past. We're just moving away from this language a little bit. Number two, adults and children take the same amount of time to recover from a concussion. So this one is also false. Children can take a little bit longer to recover from their concussions, and that's just because their brains are still growing. So sometimes it can take 4 weeks for their symptoms to fully disappear. All right, so one of the biggest questions that I get, especially when I tell people that I have a special interest in concussion treatment as a physiotherapist, is how can physiotherapists help? So, number one, being followed by a healthcare professional as you navigate your concussion symptoms can be hugely beneficial. We can help with doing an initial assessment in the first couple of days after you sustain a concussion, help you get a diagnosis using some of our assessment tools, and especially help with education and acute management in the first couple of days and going forwards. We can also help, we have people coming in, years after they sustain a concussion for treatment. So long-term management or helping you get back to certain things, we can certainly help with that. However, I would say that our most important role is education. The key to navigating concussion successfully is having the knowledge, and we can help you along the way and guide you through what you should and shouldn't be doing. All right, part two of Claudia's story. Physiotherapy was a key aspect of my healing process. They corrected my eye tracking and worked with me to regain my balance. They also helped to re-strengthen my injured neck muscles and even helped with pain relief as I was able to get acupuncture in my head. So these are some of the things that we might work on in physiotherapy treatment for a concussion. What are some other symptom management tips and tricks and things that we might go over in the first few weeks? Number one, helping with some of that noise sensitivity is I love to recommend musician earplugs or noise canceling headphones. So when I say musician earplugs, those are the little pieces. They're not the foam ones that completely block out sound. You can get them on Amazon or from most music stores. But what they do is they look a little bit different. They look like earplugs that go all the way inside your ears. And instead of blocking noise completely, they work to reduce the noise. So you can still hear perfectly fine, but for example, if the noise that was coming into your ears was at 37 decibels, the musician earplugs would just bring it down to 27. Okay, so it just reduces the intensity, which can be really, really helpful for settings such as the grocery store, social events like parties, dinner parties, things like that. Anything where there's just like a little bit too much stimulus and you know that it's going to make your concussion symptoms worse. And then the noise canceling headphones are obviously just for like the complete noise blocking if things are way too loud. Sunglasses, yellow tinted glasses can be really useful in the initial stages for blocking out light. And then binasal occlusion is a strategy that we use where we take sunglasses or regular glasses with clear lenses, and you pop the lenses out and you add pieces of tape on the inside of the nose piece here, and it separates your eye fields, making it easier for you to read. So that's something that if you're having trouble with reading, that we can go through how to do as well. Another strategy for people who have a lot of dizziness after concussions is wearing compressive clothing. So we use weighted vests, compression vests, things like that to help people wear when they're driving, or again, when they're out and about at the grocery store, going to an event that might be a little bit anxiety provoking. It really helps with those feelings of stability and helps with grounding. And then helping people manage the settings on their phones. So increasing font size, reversing the black and the white. So it's the black backgrounds, which makes things a lot easier, and night mode settings. In terms of physiotherapy treatment, there's a lot of other things that we try to do. As I said before, I think the biggest role that physiotherapists play in concussion management is education. So we help work on sleep management, so helping make sure people have proper sleep hygiene, planning and pacing, which is a type of approach you take to concussions where you take the activities that you need in a day and help spread them out appropriately so you don't have those big swings, big increases in your symptoms. We help work on balance and coordination, so static balance, dynamic balance, coordination of head movements, return to sport. We work on vision and vestibular treatments, so vision tracking exercises, vestibular habituation, strategies to lessen your eye strain, and then reading management strategies. And then, of course, we also work on orthopedic treatment. So we have manual therapy, hands-on techniques to help if you have neck issues, neck muscle strengthening, neck range of motion, posture. And then as a pain management technique, sometimes we might introduce acupuncture for your scalp, the top of your head, or for in your shoulders. All right, part 3 of Claudia's story. So I was given daily exercises, which eventually resulted in the complete healing of my concussion. And without physiotherapy, I strongly would not believe that I recovered as quickly as I did. So this is just attesting to how important that close follow-up can be after sustaining concussions and how important it is for, especially if you have high-level activities to return to. So work, sports, and things like that. So that's it for me. That's everything I have for you guys. I hope that some of that was helpful. And of course, if you have any more questions, or if you feel like a concussion assessment is something that would be right for you, or even if you're not sure, please feel free to give us a call. The information for the clinic is up there on the screen, and someone would be happy to chat through whether a concussion assessment would be right for you and whether or not you might benefit from it. If you have any other questions not to do with concussion treatment, you can always give us a shout. My information and my name is up there. You can always ask to talk to me. And I hope that this was helpful. And if, as always, chat soon.